What would you do if in the blink of an eye you couldn't stand up, much less walk, and you couldn't even yell for help? Stroke can happen without warning, and if you don't get help immediately, you can suffer severe permanent damage. Here's this month's Prescription Arkansas report.
Went down, and I couldn't get back up, and I told my wife to just give me a minute. Maybe I could try to set myself together. And I could never get back. I could never get back together again.
And I immediately jumped up and went to him to see what was going on.
I couldn't help. I couldn't even talk. He shut my mouth up. I couldn't even holler for help. Yes, Lord.
So I immediately called 911, and at that time when I called 911, they immediately sent someone to my rescue.
I remember my wife just telling me, hold on, and I don't remember.
Well, luckily I was already in the emergency room that day, and the emergency room physician immediately alerted me. He'd already had a CT scan that showed no evidence of damage, which is often the case early after stroke symptoms start. And we were able to initiate therapy within the next hour.
Dr. Boop says James Marshall was treated with a drug that has shown great success in opening arteries and restoring blood flow to the brain, helping improve symptoms.
The most important one is a drug called TPA, or tissue plasminogen activator. This drug's also been used in heart disease to open up the coronary arteries, but it works in the brain as well if it's given early. The problem is, with time, there's also damage to arteries, and if you give this drug too late, then there can be serious bleeding in the brain.
For James, it meant a big difference in his recovery.
Because of this treatment, the size of his stroke was reduced, and he was able to recover almost normal movement and normal language when he had come in paralyzed on one side and unable to speak.
For his wife Linda and sister Phyllis, the return of movement on his right side was nothing short of a miracle.
It was the scariest moment when it happened, but after his activities on his right side was going on, and then we got excited and we just kicked in that faith, and we were ready to just give God the praise.
Reservation.
James has been working so hard at his recovery. He says he's thankful for the treatment that has given him back much of his movement.
I'm thankful I can raise my arm and, kick my legs, and I thank God. I really do.
Dr. Boop says the TPA treatment is not for everyone. People on blood thinners or those who've had recent surgery or punctures in the arteries and run a risk of bleeding can't use the drug. But there is still a better chance of recovery for those patients who get to the hospital as fast as possible.